For introducing yourselves, and that'll provide some context for all of those on the call. The important thing is that we have 6 members here this morning, and we had 5 on the call that we did in midweek a few weeks ago. And so all of the students are excited for a new cohort to come on board, and these guys will serve as student mentors for the newest cohort that comes on in the fall of 21. So thanks a lot. All right, so an overview of the program. You're probably aware that this is a Doctor of Nursing practice program, but that's in contrast to a Doctor of Nurse Anesthesia practice program. And so that DNP is the degree that you will earn upon graduation from this program. It really just has to do with the host institution where they're housed. Those programs in a School of Nursing will offer a Doctor of Nursing practice degree. Those programs housed in something other than a School of Nursing will likely offer a Doctor of Nurse Anesthesia practice degree. Our curriculum is 88 credits in length. It is a full-time curriculum. It has hybrid features. That means a mix of online and face-to-face courses. We'll get into what those courses specifically are in the next few slides. We require 2,000 clinical hours of practice, and that's a standard minimum that is required of the Council on Accreditation of Nurse Anesthesia Educational Programs, and that's the COA that you see on the right side of the screen. We were accredited by them in October of 2019 for 5 years. So our accreditation, that's a standard initial accreditation, and we will renew our accreditation in the fall of 2024. We are allowed to have a maximum of 15 students per cohort, so that's what we admitted, and that's the most that we would ever admit unless we applied for more. I personally don't want to expand. I like having a smaller cohort where I know my students, and I've had contact with a number of you in prior emails and such, and it's nice to know who is who, and I think the student finds that comforting as well. So I'm the primary. I started the program. I'm Aaron Ostrowski. My degree is a DNP. I earned it from the University of Pittsburgh in 2016. My licensure in the state of West Virginia is an advanced practice registered nurse, also as a registered nurse, but I was able to become an APRN moving from Pennsylvania, which doesn't have that licensure, to West Virginia in 2017 to take this job and to also work at Ruby Memorial Hospital as a clinical CRNA, which is my certification. So you see those credentials there. I'm the program director. I've been in practice as a CRNA for 19 years. I've been a nurse since 1993. And I was a nurse for about 7 years before I went back to anesthesia school and graduated from University of Pittsburgh with my master's in the science of nursing in 2001. I've been involved in education really since I graduated from my MSN degree Pitt program, doing guest lecturing initially, and then becoming a more formal part of the Pitt faculty in 2008. And I was in charge of modules in cardiac, neuroanesthesia, trauma, and doing a lot of simulation in all of those aspects, in charge of the basic principles workshops, meaning that, well, I'll explain what that means in a simulation slide, but we basically build you from stage to stage through our basic principles course to learn how to do a complete, but simple, but complete anesthetic by the end of your first clinical semester. And Dr. Frame is here with us today, and he introduced himself briefly. If he wants to say a little bit more about his history in practice and education, he can go ahead and speak up now.
Good morning. I graduated from Marshall, the CAMC Nurse Anesthesia program in 2004, and have enjoyed a very diverse experience history. I spent over a decade in independent practice giving anesthesia with just myself and a surgeon. Was very rewarding, very fun. Learned a lot. But I have been in practice for 16 plus years now, teaching clinically anesthesia students for a long time, but full time and didactic teaching for the past um, 3 going on 4 years now. So I love teaching. It's a passion that Dr. Ostrowski and I both share, and we're very committed to the program and excited. So glad to be here today.
Thank you, Dr. Frame. Yeah, and with his experience, we really have a kind of all the bases covered. We are the only two faculty that are CRNAs right now in the program. We don't have any other faculty contributing just yet. We wanted to, with this first cohort of 15, I advise 7 students. Dr. Frame advises 8. And that means from just the academic advising of regular courses to advising on the DNP project, which I'll talk a little bit about throughout this presentation. We will add faculty as we add cohorts, and eventually we will have, the plan is to have about 4 part-time faculty that will be responsible for course development and academic advising and project advising as well, just like we are. But we're developing all the new courses, and when you have a smaller group of faculty, it's easier to keep the consistency of how the courses are developed. And we'll do that through the first run of all of these anesthesia courses. But with his practice in the past and independent CRNA practice, and my practice was in an academic medical center in Pittsburgh at UPMC Presbyterian. I worked in primarily a team model of anesthesia with an anesthesiologist. His practice in independent CRNA practice, working with his knowledge and skill set of anesthesia with a surgeon who has his or her knowledge and skill set. It's really a good mesh of the two types of practice models, and 2 major types of practice models that are out there, and we can impart that upon our students. All right, so about this program, again, a hybrid curriculum is a mixture of online and face-to-face classes. 30 credits are online, and those consist of the core DNP courses, and I'll show you in kind of a highlight what those courses are. And then there are 36 credits of face-to-face nurse anesthesia courses. And I'll walk through those as well. And they basically build from, all of the anesthesia curriculum builds from simple concepts in anesthesia to more complex as the semesters progress. We build you up from what a critical care nurse knows and does to what a nurse anesthetist knows and does. We have 15 credits of clinical practicum courses. We start small with a few hours of requirements and build pretty quickly in order to what I have budgeted for a minimum of 2,100 hours into this curriculum. So you can certainly get more than that, but my syllabus requirements are dictate each semester how many credits or how many hours that you need to accumulate in your clinical practice. And we can talk about how that works if you have questions. And then I build in, one of the things that I was advised to do in building this curriculum was to add budget in time for the faculty and the student to work on their DNP project. And that's something that you might not see in other programs as much, or you'd want to inquire about. As I said, as a faculty member, I'm your academic advisor, but also your project advisor. We call it faculty of record in this curriculum. And we work with you individually on this, developing an idea for a project and on mentoring you through the project process. So we have development, intervention, and presentation courses. We'll walk through those a little bit later. So these are the core DNP courses in the blocked red rectangles. These courses help each student to achieve well-rounded awareness of the DNP essentials. The DNP essentials are a series of cognitive and skills that the advanced practice nurse needs to acquire through their education. So you'll see that I build a lot of those into the first couple of semesters. 6 of them out of the 10 are in the first 2 semesters, and then the rest of them are kind of peppered through as you would need to know that information, perhaps for your DNP project, or kind of as you get more of an awareness of the profession and can kind of appreciate the concepts that are being discussed later on in the curriculum. So initially, you have advanced pathophys, research statistics, and scientific underpinnings of the DNP role. So, scientific underpinnings is going to help you understand like how you have to get your mind right to understand what the DNP advanced practice nurse is supposed to do. What is that nurse supposed to do? How are they supposed to kind of build their thinking around this profession as they move forward? Health research statistics is something that's going to help you understand literature research to look into your project idea, and will also be something that you have to understand to write your project's manuscript towards the end. Then advanced patho is going to build a foundation for what we will go much deeper on in the anesthesia curriculum. Advanced pharmacotherapeutics is a pharm course that covers a broad range of pharmacology topics, and we will go much deeper in the anesthesia curriculum on anesthesia-specific pharmacology in later courses. Advanced lifespan assessment helps you understand head-to-toe assessment of your patients, to ask a thorough and complete health history, and to do the proper physical assessments of all the body systems. Evidence-based practice methods introduces you to the research process and helps you to translate that research information into a DNP project idea. And then population health promotion helps you to understand the needs of populations, not in just the world that you live, but also in the region, state, and national needs that are going on. Transforming healthcare through information technology is an informatics course, and that will be introducing you to technology in healthcare and how you can perhaps incorporate it into your project. Healthcare leadership will be a course that develops your skills as a healthcare leader. As a nurse in advanced practice, you're going to be expected to step up and work just beyond the clinical realm and get into perhaps the administrative realm as well. And this will prepare you for that. And healthcare issues, ethics, and policy. We will introduce you into nurse anesthesia specific issues, but this course will give you broad advanced practice nursing awareness of the issues and the ethics and policy needs of our profession. Then these highlighted courses are the nurse anesthesia courses, and in general, they build from a very simple to a more complex type of preparation. So we start in Nursing 740A with just a broad introduction to the nurse anesthesia profession. Kind of goes hand in hand with the scientific underpinnings course and understanding the broad strokes of the role of an advanced practice nurse anesthetist. And genetics, chemistry, and physics will be the first course that you kind of get into the science concepts of anesthesia. So genetics plays a very important role in how our patients respond to anesthesia. Chemistry is very important in how our anesthetics work in our patients. And then the physics is also concepts of how like our gases get into our bodies and how they impact the physiology of our patients. Foundations courses teach you the basic principles of anesthesia. So we have a 742A and 742B in the following semester. In my prior curriculum that I was part of at the University of Pittsburgh, we did this as a 5-credit 1-semester course, and it was a monster. And in redesigning that curriculum, they split it into 2, and I thought that was a good idea. So I carried that over here, and we teach you basic concepts in fluid management, review the autonomic nervous system and how it gets specific to the management of anesthetics. We're talking about these topics as we plan this course, even this summer for the next couple of weeks. So when we start the fall semester, we're going to teach you how to position the patient, how to manage the airway. And, as we teach that in class, we have a sister lab course, the Foundations of Anesthesia Lab, that will include workshops that will take the didactic content and literally that same week or the following week, take the student into the lab, and we teach you how to do the proper positioning of the patient, how to manage the airway, how to insert an IV or an art line. And then we get to the final part of that course. We're doing what's called a mock induction, and I'll show you that sequence in our simulation slide that I have in a few slides. Then we get into advanced anatomy, physiology, and pathophysiology. That is a 2-semester course. We concentrate on the cardiac, pulmonary, and central nervous system in the first course. You can see in the second course, we focus on other systems, hepatic, renal, and other, endocrine, for instance. Advanced pharm is going to be the deeper dive into pharmacology concepts for you, and talk specifically about anesthesia drugs and how they interact with other medications the patient may be taking. Perioperative assessment and care will be a diagnostics course where we'll teach you about X-ray reading, looking at EKGs and how to properly read those. We'll teach you how to write orders. We'll teach you, and it also have several simulations in cardiac, neuro, and thoracic anesthesia, and help you prepare to set up for those cases, because you'll enter a specialties anesthesia clinical practicum starting that semester. Advanced principles courses get into more involved management scenarios of those cases. So you can see advanced principles of anesthesia 1 will involve cardiothoracic, vascular, and neuro anesthesia. So the simulations that we'll do will feed right into that. Then in advanced principles 2 and 3, we talk about lifespan issues, and in advanced principles 3, management of special populations. So from the very young, you'll learn pediatric anesthesia management in the lifespan course up to the special needs of geriatrics. In the management of special populations, that's what we'll talk about, the ways that we can address like the opioid crisis and take care of pain management. We have great resources with pain management CRNAs throughout the state that can come and talk to you about that. And I want to point out nursing 740B, professional issues in nurse anesthesia. That's a sister course to the first semester 740A course. That is a way to kind of introduce, 740A introduces you to the profession of nurse anesthesia. 740B is going to, after you've gone through all of the courses and clinical experiences of the prior year, you're going to have a broader perspective on what this profession is really like on the front lines, and you'll have a new perspective, and you'll have gone to a few professional meetings and experienced some different things, and you can bring that perspective to bear in professional issues in nurse anesthesia 740B. I have worked long enough in the profession to know that CRNAs don't have a business mind, and so I wanted to introduce business management and finance and nurse anesthesia practice to our students, and help you understand what value you bring to the profession, and the value that you bring to your employer. And so we'll talk about those issues in that course. Then evidence-based anesthesia review is a built-in review course that prepares you for the certification exam, which is what you take upon graduation. So this will you'll hear about different review courses in the throughout your student experience. We have one built in. You're welcome to take other ones as well. The more preparation that you have, the better. So we will help to ensure that you pass, because that will be all of this education and preparation is for nothing if you can't pass that certification exam. So we'll make sure that happens, give you every potential preparation to make that happen. Now, a little bit about the DNP project before I show you the project courses, but the DNP project is an integrated kind of parallel process to the specialty courses that you'll take and the clinical training that you'll do in this curriculum. It's, prior to the DNP degree, all of the clinical and specialty courses are pretty much the same, and would get you a master's degree in anesthesia before. The DNP project has added a scholarly component to this, and that's what's made this a doctoral program. All programs are required by 2022 for entry into this profession are required to offer a DNP or a DNAP degree. So, a doctoral degree is required for all students entering 2022. And these projects can be in the quality improvement realm most commonly. It could be a policy analysis, and there's some other types, but the objectives for it include that you would assess the practice environment and figure out, what would you like to change? What could you change in this environment? And if there are any variances from, say, national benchmarks, like this is the way things are supposed to be for, say your ICU unit or something like that. But that your unit is performing down here, whatever that benchmark is. You could, explore the evidence and see what can bring that unit's performance up to national benchmarks. So you can refine and address a practice problem and improve upon it. Now, I would imagine that there's going to be some discussion about that. I would encourage it from our students. They've been going through the DNP project process pretty deliberately in the last semester, so I would welcome their feedback on that when we get to the end here. So critically appraising the literature, designing an initiative to address the practice problem. You need to seek approval from the school and the host institution. So, you have the school component where, we are your faculty, but you also have to find a clinical site to implement your project. You need approval from both entities to have your project work. You implement the project, you collect data, evaluate the outcomes, and then write up a manuscript to present the outcomes and kind of analyze it to see, did my idea work? Did it not? What could we improve on? What could be changed? What would require further evaluation in the future? So again, I mentioned that we build in time to do this, and in the highlighting of these boxes, you see that there's no DNP project in the first couple semesters because those DNP core courses prepare you for the development course in the third semester. You're required by the school to have a minimum of 6 credits of DNP project to graduate. I've budgeted in 7 to give you extra time in kind of preparing this course. Once clinical hits, I've been advised by other DNP project or DNP programs that students need this time. So I gave basically an extra semester's worth of credit to do that. If a student gets done in 6 credits, I think we can make arrangements for an independent study or something like that. You still need 88 credits at the end of the program to graduate. So DNP project development is where the student needs to develop a project idea, do a literature search, determine the standard, and how a change that needs to occur can occur. And that's what a lot of students in the current cohort are going through right now. And then they will enter DNP project implementation, which are a series of learning contracts each semester with the faculty of record to achieve certain objectives with the project in each semester. And then in the end, and not necessarily in the final semester, really the idea is to get this project done earlier than later in the program, to do a DNP project presentation where you write a manuscript, you write up a presentation, and basically on PowerPoint with all of your findings and summarizing what your project achieved. And that is done in front of your committee and peers and stakeholders involved with your project. Now, the clinical commitment is a minimum of 2,000 hours and 600 cases. Those are the absolute minimums that are required by the accrediting body, the COA. And a lot of programs can achieve more hours, at least in the master's curriculum. It's yet to be seen what the average is going to be for doctoral programs, but it's likely going to be lower on average than what the master's programs have been able to achieve in the past. But you're still going to have to achieve at least 2,000 hours. Again, I'll show you that I have budgeted in 2,100 hours for you guys to achieve certain benchmarks each semester. We have clinical sites throughout West Virginia, Maryland, Ohio, and Pennsylvania. And they're kind of mapped out like this. So Morgantown's pretty much in the center of this map. And we have 2 clinical sites in Morgantown, Ruby, and Mon General hospitals. And we have one just down the interstate on 79, WVU Medicine's United Hospital Center. So that's in Bridgeport, West Virginia, about 35 miles away. These 3 sites are going to serve as like the primary starter hospitals for our clinical practicum. And those kind of keep you close to home, close to the nest, so that if I need to, address any issues with new folks starting, I can, be there much more readily. We do have sites that are more remote, Conemaugh in Johnstown, PA. We have Cumberland, Western Maryland, UPMC affiliate in Cumberland there. We have WVU Medicine hospitals near the Martinsburg area. So Berkeley Medical Center and Jefferson Medical Center in Ranson, just a few miles south of Berkeley. The benefit of having these more remote sites is some of them are CRNA only. They also give you a better, even if they are a team model where you work with an anesthesiologist and a CRNA, you get an idea of working in a smaller community-based hospital of limited resources, and what you need to do in cases where you may have to somewhat improvise in the care of a patient. And we'll give you the tools for that, but you don't go to those rotations until later in the program. We have other sites in the southern parts of the state. Stonewall Jackson is a CRNA only site. Somersville is a CRNA only site. And then Raleigh General is in Beckley, West Virginia. That's really south of this map. And that's more a little larger hospital that offers a team model. And then we have 2 sites in Huntington, West Virginia, Cabell Huntington, and St. Mary's. We're providing good clinical experience in cardiac, and a lot of issues with narcotic abuse down there. You can learn some different non-narcotic, narcotic sparing techniques there. We have Camden Clark in Parkersburg and Marietta Memorial, which promises to be a great regional experience. We have former colleagues that I've known that work there currently, so it'll be a good experience there. So those are our clinical sites. You will have to drive in this program. You will not have to go to every clinical site that you see on this map. Everybody will, I'm sure, rotate through Ruby, Mon General, and like the UHC at some point in their training. Then the more remote sites will offer unique experiences that most of them offer housing. Some of the stays at those more remote places will be at a reduced student rate, but we will work out details with each student as we go through each semester. And this is where clinical practicums are inserted. So you can see that there is no clinical practice in the first 2 semesters. I devoted the first 2 semesters to getting the core DNP courses kind of out of the way, get you prepared for the DNP project. Then the 3rd semester involves starting clinical practicum. In red, you have the numbers for hours that are required in each of those semesters. The foundations clinical practicum will not start until later in the semester. If the summer semester starts in May, you will have about 8 or 9 weeks of workshops to get you prepared to enter the clinical site in like about the 9th week, and you'll have weeks 9, 10, 11, and 12 to acquire 60 hours of practice. And that's all the first semester requires for clinical practicum. Then you'll have to acquire 300 per semester from then on until the last 2 semesters, when you need to acquire 450. And you can see the credits build throughout those semesters. Roughly 1 credit hour equals 150 hours on the clock. Okay. And this is the simulation slide that I was going to talk to you about. Mentioned earlier that you'll be doing a lot of simulation in this program. And this really is where the didactic preparation and concepts come to life and help you understand concepts that we explained in the classroom. So the site for the clinical, or I should say simulation training, will be in the STEP Center, and that stands for the West Virginia Simulation Training and Education for Patient Safety Center, so STEPS. And so simulation is weaved throughout the curriculum. We do a lot in the early phase to get you prepared for clinical entry. Roughly 60 hours per student. It'll probably be over that. I could see, if nothing else, adding more simulation to this program, certainly not taking it away. But what simulation does is helps the student learn high stakes skills and practice high stakes scenarios in a learning environment that's safe, where if a vital sign goes badly and there could be a poor outcome in a real clinical realm, in simulation the patient doesn't die. You merely hit reset and go through it again and talk about it and figure out what you could do differently or improve upon. So in the first semester clinical preparation course is the Foundations of Anesthesia Lab. And we talked to you about anesthesia workspace preparation. Basically, how do you check and set up an endotracheal tube for intubation? How do you get the different tools of anesthesia ready for use? We'll talk to you about that there. Assessment is not just talking about assessment, but actually doing it and talking through scenarios that come up in anesthesia: basic airway management. You learn how to intubate the patient through different techniques, whether it's oral or nasal or doing it on a pediatric patient. That's more just for practice. You won't be doing a lot of peds cases early in this curriculum. You'll be doing a little later. Monitoring and positioning. You flip-flop in bed more times than you really understand or recognize throughout your a night's sleep. But patients in the OR have to lay still for sometimes hours at a time, and we teach you how to position them to safely protect their bony prominences, to pad them, to protect their nerves and such. I mentioned vascular access before. You learn intravenous cannulation and arterial line insertion in this workshop. Getting in the gas machine workshop, we actually already had this for the first group, and they learned some of the details, got their hands on a real gas machine that works. We'll walk them through a real OR in the next few weeks to look at the gas machine that's live and in a real OR and the different features of it that they need to know and how to troubleshoot. Then it culminates with a mock anesthetic induction, where all of the previous workshops kind of scaffold into a combined experience where you will assess the patient, check the gas machine with a colleague, go through an induction of anesthesia, knowing the drugs and the doses and how much to give and how long it should be before they should act and when the patient would be asleep, and how to intubate them, get them placed on the ventilator, and kind of get the case started, and to manage a minor change to the vital signs and figure out how to get through those first few minutes after an induction of anesthetic. Then in future courses in Foundations of Regional Anesthesia, we will have you go through a regional anesthesia workshop, learning spinals, epidurals, and some common regional blocks. And in perioperative assessment and care, I already talked about diagnostics and such, but we'll add in workshops in ultrasound and central venous cannulation. So learning jugular, subclavian, femoral approaches to getting a central line in. And I mentioned the simulations in cardiac, thoracic, neuro. In lifespan, I mentioned doing pediatrics. We will teach you about pediatric specifics and then go into doing the pediatric simulation in that course. Then finally, management and special populations. You learn basic airway skills, management skills, and basic principles. You will learn difficult airway management in an advanced course. So that's where you'll learn how to do a translaryngeal puncture for a jet ventilation. You'll learn how to do fiber optic intubation for double lumen tube placement, for difficult airway placement. And we'll also do a trauma and pain management simulation in that workshop. All right, well, so that's a lot of the good news. And then the bad news, perhaps, would be just how much is this going to cost you? And you can see breakdowns of costs with the additional fees. And the bottom line is for the difference between in-state and out-of-state residents is $117,000, give or take, to upwards of $189,000 or $190,000 for out-of-state residents. And the difference really comes from the university's philosophy to train and prepare West Virginians to take care of West Virginians. West Virginia is a state that's often has had its challenges in economic and educational realms, and this university values, as a land grant institution, the training and education of West Virginians. So there is certainly an incentive for residents to stay and do their education in West Virginia, but it can cost non-residents, and that's what's shown here. However, the laptop program is a program in which the university buys, in this case, Apple laptops, and you get your own MacBook, and they will not only purchase it for you, but they load it with all of the software that you need based on consultation with me. They see what software that a student in this program needs, and will warrant it, will service it, any kind of problems that come up with it, that goes to the IT service laptop program service. So that's what the laptop program is. Then there's AANA membership, which is the professional organization. Students can join for $200 one time for the 3 years. APEX is a supplement to lecture material. It will prepare you for boards. It's a great source of learning and review that can be with you throughout the program, and it's built in with quizzes and tests, and very helpful. Typhon is a system that you can log into to track your clinical hours, your DNP project hours, and prepares basically a transcript for you and for the program to submit to the certification body, the National Board of Certification and Recertification of Nurse Anesthetists. We have to submit that to them upon your graduation to show that you've done all of these hours, you've met all the requirements for time for graduation. PreCheck is a service that takes all of your documents that you need to be a student at West Virginia, and also to go to clinical, and can be a place to deposit your critical information. They'll keep it confidential, but you can access it and submit it to any entity that needs to know that you've had vaccinations, your health history done, that you've had background checks done, that you've had immunizations, vaccinations, and I'm forgetting one component of it, but that's what PreCheck does. Then the C is a self-evaluation examination. It's done about 2/3 of the way through the program. We'll do it kind of at the beginning of your final year, and it's an assessment of how you've grasped the concepts, and gives you a score, and will help to guide us and you in your preparation in the final year of building your knowledge base so that you can be prepared for the certification exam at the end of the course, or at the end of the curriculum. My clinical exchange is similar to PreCheck, but is a requirement of various clinical sites that takes all of your documents and manages them for the clinical site. You'll have to renew your license as you would in your regular nursing career. So maintaining your licensure, you have to maintain certifications in basic life support, advanced cardiac life support, and PALS. You'll have to have those upon admission. If you don't have PALS upon application and interview, you need to acquire it certainly before you start any clinical practice. And it's probably something you want to just get out of the way before you start school, and get on your resume, just to get it done. Books are budgeted at about $150 per semester, but I'll say that you're going to really have most of your book expense early on. If you need to buy 1 or 2 anesthesia books, we have a number of them available electronically through the university's health sciences library. And but I personally sometimes like to read a physical hard copy right in front of me. Whatever your preference is, there's flexibility with that. You are required to maintain health insurance. If you don't have the resources for health insurance, meaning access to buy otherwise, the university will have a health insurance program that you can. You would have to actually elect to not take the health insurance each semester. So it's you have to turn it down each semester in order to not have that show up on your bill. And I think that's the case. Students can confirm that. But then we charge $100 for a lab fee every semester in order to support the simulation that we do in steps. Then the X factor in all of this is really, beyond this expense, what is your housing going to be? There are going to be travel needs that you have either to clinical sites and such, but if you decide to take vacations, that's really speaks to your lifestyle. And, are you willing to, as I have said, do ramen versus caviar? And, what's that lifestyle? That's going to really determine your student debt, how it mushrooms throughout this program. All right, time commitment. Common question comes into play is, can I work throughout this program? And that might be the case. I'd say if you, have to work for, family needs or health insurance needs or whatever, it's feasible maybe throughout the first couple semesters. But once clinical starts, and you can see the number of hours that you need to accumulate for clinical, that could be problematic to work during that time. I cannot forbid you from working, but I think that you can take a look at this time commitment and deduce that for yourself, taking into account clinical time. So look at the 2,000 hours that you need to accumulate, which is basically over six semesters in a month. A full-time job is 2,080 hours. So, 2,000 hours over 6 semesters or 2 years is a half of an FTE. And clinical preparation takes about an hour or two each night in order to, look up your patient, to know, what procedure they're having, what their allergies are, and, their complete health history, and to come up with some, issues that you might encounter in taking care of that patient. Plus, you may have never, seen this disorder before or the procedure, and you need to look up those things. It could take 1 or 2 hours a night easily to write up a management plan for that patient. Class time, 1 clock hour per credit hour per week is, when you see a credit hour, so a 3-credit course would take 3 hours per week, and that's in class. So that could be in this progression plan that you see 8 to 12 hours per week, depending on the semester. So that's a quarter of an FTE. Reading, writing, study time outside of class, the ratio there is projected to be 3 clock hours per credit hour per week. That's how we build not just what we present to you in class, but the work that we give you in terms of reading and doing some kind of, say, math exercises to get your anesthesia math skills up to par, writing for the DNP project, study time. That could be 24 to 40 hours per week. I think some of our students would support that notion of the writing. That could take some time. That could be another half to 1.0 FTEs. So really what this boils down to on the worst case scenario is almost working 2 full-time jobs. And this is when clinical starts. So, you might have roughly another full-time job. If you take out the 0.5 in the middle there for clinical, you might have basically like you're working another full-time job, just doing the non-clinical work. So it takes a chunk of time to get this program done. Admissions criteria, I'm going on way too long. BSN from a nationally accredited nursing program, a minimum GPA of 3 on a 4.0 scale. So you've all seen this. I've gotten questions from you about it. Need to be licensed in West Virginia, complete the stats and assessment courses. The GRE requirements come up now and then. Yes, we require it, and we do advertise that in our website. There are no exceptions for COVID at this time. So that's everybody is expected to submit a GRE score. Critical care experience. the standard requirement is 1 year of critical care experience, but I prefer 2 to 3 years. And that experience should be current, working on in some way, shape, or form in a critical care environment at the time of application, and ideally at the time of enrollment. Then essay, we have an essay as part of the broader School of Nursing at West Virginia. We have an essay requirement that goes in all programs. All students get the same essay. And it's basically nursing philosophy and how that role plays into your development as a nurse. Letters of recommendation. Hopefully you can find 3 people who would support you and recommend you to this program. And then if all of that works out, you'll come in for an interview, and that is really a round robin where you would sit with me and another person, and Dr. Frame and another person, and another, probably a third pair of faculty that would be involved with graduate studies, and interview you and ask you a series of questions. We're not here to ask you a lot of anesthesia questions. Our job is to teach you anesthesia. So we're not going to ask you what the onset time is for rocuronium, and how you would use that in the context of a certain patient. So that's not your job as an applicant. That's our job as faculty to teach you that. Applications open today. So I believe if we all went to I haven't done it yet this morning, but if we went to the DNP Nurse Anesthetist website, that an Apply Now button should show up, and applications will be screened for completion. If they're complete, we'll call you for an interview. If they're not complete, we'll send you a reminder, but we're not going to hound you either. But we'd like to see those applications complete. Interviews will be conducted in January, and whether they're done in person or on Zoom, that'll be yet to be determined, but we'll inform you about that. We'll see how this COVID restrictions progress. Talked about the round robin interviews. We'll tour you through the School of Nursing, Health Sciences Center, and STEPS. And decisions will follow soon after for all students who are going to be entering the second cohort, which will start in the fall of 2021. With that, I'd be happy to take any questions. So what if we had any questions come up through the chat?
We have not, Aaron. It's kind of quiet. So if anybody has any questions, you're more than welcome to ask them in the chat, or you're welcome to unmute yourself and ask any questions to, Caitlin or myself, or Dr. Frame or Dr. Ostrowski, or any of the students as well.
So I see minimum requirement for the GRE score. Nope, no minimum requirement. It's just, we want to see a score that you have taken. If there's any score that I look at, it might be the quantitative, the math-oriented score. But all students in the admission rubric get credit for taking that exam. It's not really shown to be extremely correlative to success in a nurse anesthesia program. It'll be something that I look at over time as I correlate that score with GPA through the program, with performance on that C exam to certification, and it might be something that we don't have to pay attention to in the future. But for now, we are asking for a GRE score. Got a request from Shalanda that how many applicants? We received 36 last year. I have no idea how many we'll get this year. I would venture to say that depends on where you kind of fall in personality wise, that maybe you're a little more adventurous to apply to the first cohort, and maybe there's a subset out there that we're waiting to see if, first of all, if this program was going to get accredited. So we'll see. I have no idea. It'll be interesting to see what the second group of applicants, how many we get. And as far as interviewing, I would like to interview, I like to interview 3 for every spot in the cohort. So I'd like to interview about 45. More than that actually gets to be pretty taxing on the resources for interviewing. So I'd like to interview as many as 45. Clinical placements. Yeah, so clinical placements that are more distant, we would anticipate you staying there and not having to commute back and forth. And that's where housing and such would come into play. That if we can arrange housing at more remote sites, that'd be the ideal, and we'll shoot for that. If not, it would be we would negotiate reduced rates for students to stay at a housing arrangement where you have to pay for it. I think, and so there's a question here. This is for if everybody can see the chat, students, in regards to the face-to-face class time. Most have moved to Morgantown to be in the face-to-face program. So any feedback from any students there?
I don't know if my microphone's working.
Yep, we can hear you.
Woo! So I moved. I wanted to get the full experience, and I wanted to be in Morgantown, and I wanted to be on campus, because if I'm going to commit to a program, I want to commit all the way. But that's just personal preference. So.
And thanks, Megan. In regards to the face-to-face class time, so yeah, if you live 2.5 hours away, you might want to consider moving closer. But as far as being in class, I'm going to try to have classes no more than 2 days per week. If there's possibility of having all of our classes, even in semesters with multiple courses, we'll try to have them on the same day. But for instance, in the semester with an advanced principles course in pathophysiology, an advanced course in management of cardiac and thoracic, and then the perioperative assessment and care course, that would really lead to about 8 hours of class in one day. You don't want that. I don't want that. So we're currently scheduling that over 2 days. But for the most part, we're going to try to keep classes together on the same day so that you can have one, opportunity to get out of Dodge if you need to for your own health. And if you need to commute to a clinical site, you can do that. So we're going to try to be mindful of that. Average number of years of experience for students in the program has been, I think for this cohort, between 3 and 4 years. Some have more, but all of the students in the current cohort got full credit for their nursing experience in our admissions, which really kind of maxes out at about 2.5 years. Because I wanted, that 2 to 3 years to be reflected in the admissions criteria. Each clinical site would be approximately 3 months in general. Once you get to a more specialized rotation, it might be pediatrics or cardiac. You won't necessarily do pediatrics or cardiac for 3 months of one rotation. It's likely that you would be assigned to a specialties rotation where you do cardiac for a month, neuro anesthesia for a month, thoracics for 2 or 3 weeks, and then maybe pediatrics if offered at that institution for another part of that rotation. So that's how the specialties rotations are intended to be laid out. But the average clinical rotation would be about 3 months. If you went to like the CRNA only sites would be valuable for the professional experience. but the sites may not offer a great variety in cases. So we'll see how we do that. I would imagine, that would be a 1 to 2 month rotation, and we would just, rotate more senior students out into that rotation on a regular basis. So we're working out those details. And institutional scholarships are available. There is a doctoral nursing fellowship that's available that can, if you're, it's a highly competitive, there's one available to the School of Nursing that takes care of tuition for a whole year, and it doesn't address fees, but it can address tuition. So if you are, qualifications are to be a doctoral student full-time, and I'll say that the only program that's a doctoral program and full-time in the School of Nursing is the Nurse Anesthetist program. So that's a small pool of people from which to choose and grant you a full year's tuition. So that's currently being evaluated among our cohort, and that's a possibility. And then the other, there are other possibilities for funding. The Nurse Anesthetist program has received a grant. It's a small amount of money right now, $18,000, but we're able to distribute that through the cohort. I can only give away $1,000 in this first year, but in the subsequent years, it'll be $6,000 next year, and $11,000 in the final year. So, and that's actually news to the current cohort. So, but I have not been able to disclose a whole lot of that just yet. So you guys are getting some privileged information. Then applying for licensure. Can we apply with a PA license, or does it have to be an active WV license? You would have to, do you guys have any ideas on that, Caitlin or Philip? The licensure piece?
I think you can apply if you have like a Pennsylvania license. You just would have to obtain a West Virginia license at some point during the program.
So the if you have a licensure that is active and eligible in the current state in which you practice, for application purposes, you're fine in my book. And I just didn't know. Thank you, Philip, for clarifying that. And so you can apply with a PA license that's unencumbered is the, I guess, the proper term. And then as far as experience, Andrew, it would depend on the flight nursing experience. My general knowledge of flight nursing experience is that it's pretty darn close to critical care. So, Dr. Frame, I don't know what your thoughts are on that, but it would come down to evaluating exactly what your description is of your role, and if you've had critical care experience in the past, we would consider that. I think that would be something that we would look at.
I've learned a lot about flight nursing in actually the last couple of years, and especially like with COVID right now. Scene flights. I used to think that helicopters flew scene flights pretty much. That was all they did, but that isn't the fact. Health nets are transporting ECMO patients. Well, I guess maybe not ECMO patients, but transporting very critically ill patients from one medical center to another. So they're doing ICU level care during the flight. So I think the critical care experience that you do in a helicopter is often very autonomous, as you can't have the whole healthcare team with you. So there are some benefits of being. Okay. So Shane just said he did fly an ECMO from Charleston. So I mean, you're talking. I don't know how much more critical you can get than some of those things. So, but it's the same thing with ICUs, and I have had applicants in my other life that worked in ICUs, and they were smaller ICUs, and you got to talking to the applicant, and they intubate one person a year in these ICUs. They mostly do DKA, so even ICUs have some variance, but most of the critical care experiences you'll bring to the table are valid, and that's just my 2 cents.
Thanks, Dr. Frame. Yeah, that's true. Not all critical care experiences are created equal. And, we do have a list of frequently asked questions on our website that the critical care question comes up, and I, answer that there. And I get a lot of requests about, does ED experience count? Well, and generally no. And it really comes down to the nurse that can critically think and manage mechanical ventilation, decide when not to reach out for consultation, can think on their own within the skills and protocols that they've been given, and can employ those in certain circumstances. So it's I did come from a community-based ICU in my training, and there were a lot of things that I was missing and frankly had to catch up on. But I had other students in my cohort who were, taking care of ECMO and advanced mechanical ventilation situations, and patients that were very, very sick. So not all of that is not all critical care units are created equally, but it's our accreditation organization that really makes that critical care requirement. I would like.
Dr. Ostrowski.
Yes, sir. Go ahead.
I will just say that too, for anybody with an ER only background. I echo what Dr. Ostrowski said. That was my sole background going into anesthesia school, and I've done well. And it's not to say you can't do well, but I really had to do a lot of effort on my own to get myself up to speed, because at most I only saw 1 or 2 A lines in the ER. There are a lot of things that you don't get unless you are sitting beside your ICU patient for an 8 to 12 hour shift, making those decisions when to call the doctor. That is the kind of stuff that is going to help you in the long run in anesthesia school. ER, of course, being able to respond on your feet and do that kind of stuff and critically think, you get that in ER, but it's not to the degree you would need for anesthesia school like ICU can give you.
It's a great complement to your critical care experience, but it shouldn't be your only experience. So that'd be my ultimate feedback to that. So I do want some of our current cohort members to speak up. If there aren't, certainly if there's any other questions, please type them into the chat. We'll answer them. But I'd ask of the current students, how's it going? What's it like to walk around in a WVU student nurse anesthetist's shoes? And I will call on you.
I think it's going really well. I think my only advice that I would give is just come prepared to work. Just come ready, have everything situated so you can focus on school, because it is a lot to do and a lot to accomplish, and you need to be organized and particular and just prepared with the right mindset.
Thanks, Megan.
I would echo what Meg said, especially showing up, being prepared to work, and especially, talking about the DNP portion of this program too. If you're in your work environment, definitely keep your eyes open for areas that you now in your current environment see. That is an area that I wish there could be improvement on, and start to kind of think about those tools, think about the way of developing that. And then if you, pending admission, by the time you get admitted, you'd be able to hit the ground running a little bit more readily than having to develop that early on in the program. And then 2, real quickly, I'd like to just speak on one of my favorite parts of this program is the small cohort. I think that the people that I'm surrounded with, both my classmates and then also our faculty, really, want success out of you. They really are invested in you, as evidenced by Dr. Ostrowski. When her mic was down, you were easily ready to just go with her background. So our faculty definitely know who we are. They know our strengths. They know our areas that, may need a little extra support. So that's definitely a benefit that I see in the small cohort. So my perspective.
I
And
see
this is
Lauren out there. Oh, that's Kenton. Go ahead, Kenton.
Yep. I was going to follow up with that as well, for sure, that the students feel supported for success. It's very evident in the structure of the anesthesia classes. This being the first cohort, some of the core DNP classes, were more nurse practitioner, primary care focused, but they have done a good job of trying to tailor some of those and add in some CRNA specific information as well. But there's still a little bit of a difference there, whereas the core anesthesia classes, the organization is the same for each class. They're face-to-face. Well, with COVID, we had to switch to online back in the spring, which actually was a pretty easy transition. I think partly because the class is so organized. You go onto your online database and all the information is in the same spot for each class, which makes it easy to move through the courses.
Are you referring to the Soul site there, Kenton?
Yes. Yeah, the Soul
Yeah.
site where you take your online portion of the classes, or also have the induction site, which is like the student information site. It's very helpful, and everything is very organized to the same standards.
I just wanted to say something. I remembered being in this, just listening to this presentation today, being here last year and just thinking, oh my gosh, this is so overwhelming. There's so much stuff. It's definitely a rigorous program. It's very intense. Going into this program, I had everything lined up perfectly. And then I had some unforeseen family situations that, Dr. Ostrowski and Dr. Frame have been wonderful mentors for me, just helping me get through it. And you can't always predict what is going to happen. And you can look around and see, wow, like we're in a crazy pandemic right now, but they've done a really good job just, tapering it to your needs. And I feel very grateful to be part of this program, and you guys can do it. Just take it one step at a time. It's a lot to take in at once, but they really, they'll get you through it. And we have wonderful classmates. I love everybody in our program, and it's been really nice so far. So.
Yeah, to what Lauren said there, it's really important for the interview process. It would be ideal if we can do it in person, just because you can walk around the School of Nursing, we can walk with you, whatever, and and then listen to us, we listen to you. It's going to be a matter of just feeling, is this place a fit for me? And, are we a fit for you? And those are really the two basic questions that have to be answered on that interview day.
I kind of wanted to piggyback what Lauren said. Sierra, I saw your question about children, and Shane responded to that. Yeah, I think we're all kind of, especially during this time, walking through different struggles. Lauren and I have gone through kind of some similar things, and, but I don't have kids, so I don't know what that's like, and homeschooling. And I mean, during this time in this pandemic, I did kind of want to note, so for some of you guys who do know us, that I've worked, or some of us have worked throughout this program. I do want to note that for you guys in the second cohort, your schedule is a lot different than what we had. You guys, your first 2 semesters are very heavy. I don't think I would have been able to work and do the hours that I did in the progression that you guys had. So that's just something I just wanted to highlight for you.
Yeah, what Carrie's referring to is because of our not orientation, but our accreditation schedule, we elected to have students enroll as non-degree seeking students 1 semester early, with the risk that, if we for some reason didn't get accredited, though we had a glowing accreditation visit, it was largely guaranteed, but it wasn't sealed and delivered. So they did take a risk in taking 12 credits ahead of time that were transferred into the nurse anesthesia curriculum. So in effect, their program is 10 semesters long. It's modified for this first cohort. Every cohort from the second one on will be 9 semesters. And so, yeah, to her point, the credits will be somewhat compressed into a little more per semester. It'll be the progression plan I showed you. Theirs is a little different.
I also just wanted to add one more thing. Dr. Ostrowski did a really good job just going over the overview of what the DNP program is. And I guess a little bit of lack of understanding on my part when I first applied to the program. I wasn't quite sure of what that all encompassed. It's definitely, you know, there is a core focus on anesthesia, but you're also going to be exposed to a totally different level of nursing than what you're used to. There's a lot of reading, there's a lot of writing, there's a lot of research, and that just makes you more well-rounded whenever you come out of this program. But I just wanted to emphasize that, you know, there are a lot of classes that you aren't necessarily going to be just in anesthesia. You're going to expand in other parts of the nursing profession just to become well-rounded. So that's my 2 cents.
Thanks, Lauren. I do see some question about the managing with family. It's going to be it's important. One thing I heard from the first group of students that responded in our first information session was, you know, one of our current cohort, Jessica Hughes, has 2 small boys. She's married, but you know, when COVID restrictions hit and her boys were sent home from their kindergarten or whatever for homeschool, that presented some challenges to her. I'm sure she'd be happy to talk to anybody who's interested in how she's managed through this. She'd be happy to talk to you. And then I can speak from multiple students in the past who have gone through not just, of course, this program, but in my experience at Pitt, Dr. Frame probably knows students who have gone through his prior program at Charleston, that, we've had mothers managing families of 4. And, I went through school with one son who was 1.5 when I started and, 3.5 when I finished. Of course, being a guy going through it with a mother at home, taking care of the child is different than the mother going to school. Just saying, with the mother going to school and the husband trying to manage the children at home, there can be those dynamic dad moms out there, or mom dads, however you want to say it, but it could be a different circumstance for you. We can connect you with people that can talk to you about that if you have questions about that. Just reach out to us specifically and we'll help you out. We have 5 minutes left. Happy to answer any final questions. If Shane or let's see, who haven't we heard of from the student side? If you have any final words of wisdom.
So everybody already took all the great points about our cohort and our faculty, but it's honestly better than I expected. And from coming with 10 years of work experience to go back to school, I'm not sure if any of you have any reservations about doing that, but getting back with our cohort and having the support of our faculty has been better than I could have expected. These fellow CRNA students are like an extra family to me now, and the faculty are so supportive that it's just been a great experience. So if anybody has any reservations about that, you will be supported if you come into this program. And then as far as the DNP goes, one thing that I wasn't aware of going into it, and like Jamie said, you definitely want to be thinking about these evidence-based practice changes in your clinical area going into it. But I was sort of under the impression that my DNP project was going to have to be specifically anesthesia related. And that was a bit intimidating for me, knowing that I knew nothing about anesthesia aside from working with anesthesia providers. You can do something in your clinical area of expertise too, and I'm not sure if that is has been conveyed, or is that if that's your understanding. But it definitely is a time commitment. If you are budgeting your hours from the slide that Dr. Ostrowski put up, definitely err on the high side.
Yeah, it's training in this type of program is something that I'm removed approximately 20 years from, and I'm still thankful that I'm done. So it's well worth it. You will have, it will give you confidence that you never knew you had when you can really take someone and put their lives in your hands, send them off to sleep, wake them up. And granted, these are things that these students haven't even experienced yet in the first cohort. Their clinical training is going to be coming up. But it's a great experience. And to Shane's point about, doing a project in anesthesia, it took some clarification on my part to, network with other program directors throughout the country to say, hey, look, can these folks do projects in their ICUs? Because there were fantastic ideas that came from within this group to do projects in their home ICUs. And Shane's an example of one of them. He's doing a CRRT training program for CVICU nurses in his hospital. So it's going to be a terrific organizational change to his unit. And that's something that you can think of when you're working. If you have, I would say maintain your, good graces of your management, where in the ICU where you work, kind of assess the environment, see what would you like to change? What do you know has been bothering staff nurses for years, but just hasn't been changed? And either it can be just from lack of resources. A lot of times it's just, that management doesn't have time to invest in that change. You could be that person that can invest that time because it's part of your program. So just think about that. And any closing thoughts from Philip or Caitlin or Dr. Frame? Anybody? Any final questions?
I guess from the admission side of things, I just wanted to say, if you guys have any questions along the way, I know you have Philip's contact information. I can put my email address in the chat box. So if you ever need anything, don't hesitate to reach out.
And I was just going to say, nurse anesthesia is a subset of the larger group of nurses in our nation. We have roughly 60,000 CRNAs that are members of our national association. It is a family in nurse anesthesia, and WVU is also a very rich and wealthy family as far as resources, and just the human aspect of WVU is amazing. The people we have at WVU School of Nursing make this job so wonderful and satisfying, and we all care deeply about our students. So you would be joining a wonderful family at WVU, and then anesthesia in itself is just something I have never looked back and thought, I love every minute of every day I wake up and give anesthesia. So that, for me, that is golden. I would never tell my boss this, but I would do it for free. I love it that much. But please don't tell them I said that. So we're here anytime you have questions. Dr. Ostrowski he knows this program inside and out because he birthed it. If you have concerns, shoot messages our way. But anesthesia is amazing. I would definitely highly encourage even my own children to do it. That's all I have.
Thank you, sir. And yeah, just thank you all for taking time out of your morning to be here. I don't want to take any more of it, but certainly if you have any questions and follow up, Philip's email is on the website immediately to the right side. Mine's at the bottom of the text. You can reach out. Many of you already have. Please continue to do so, and we hope to see your application maybe even later today. So just so you know, the flow of applications will go through Caitlin's portal, and she's able to access that and follow your application progress. We will be in communication on a regular basis to, see who's applied and start thinking about, reaching out for interviews and evaluating the applications. So that's the next phase of this process. Have a good weekend and happy applying. Talk to you guys later.